Hello, I'm Dr. Michael Allen, author of the books Receptor-Based Solutions, Functional Neurology Every Doctor Should Know, and What Your Brain Might Say If It Could Speak. And I'm here today with Laurent, and we're going to talk about how to adjust his own wrist. Let's say, for example, his wrist has pain in it with various movements, and it's unrelenting no matter what he does. Maybe he's wanted to wear a wrist brace to keep his wrist stable. Between applications of the brace, it's good to adjust the wrist. We've got 2 bones coming in, 2 rows of 4, and 5 bones coming off. 15 bones we have to deal with here in the wrist, and those wrist bones have to be all in sync, meshed, and afferentating properly with the muscle and joint stimulation in order to reduce the pain that he's experiencing in that wrist. So I want to teach him how to do it himself. Laurent, with your wrist this way, palm up on a flat surface, understand that there's a retinaculum or a ligament that comes from the radius to the ulna in order to keep the contents of that wrist down when you use your hand. And that the flexor retinaculum can be tired and weak, allowing the horseshoe shape of the wrist to allow the contents to move through the groove to flatten out. And if that flattens out, we call it carpal tunnel syndrome, where we get the pressure on the contents of the carpal tunnel. So I would have Laurent, I would tell him, pretend like your right hand doesn't exist right now. This is your right hand, Laurent. You're going to take your right hand and place it just distal to the styloid processes and wrap your fingers around that zone. And alternately now we're going to, with your right hand and with your left hand, alternately contract and relax your hands. So contract your left hand and relax your right hand. Now relax your left hand and contract your right hand. And we just felt his wrist adjust. Did you feel it?
Yes.
Contract your left wrist, your left hand, and then I relaxed. His right hand is now relaxed. Relax your left hand and contract the right hand. So let's go back and forth a few times. Contract and relax. And alternately, I'm adjusting at the same time, but opposite. You see this? Okay. After a few times of doing this, then I have him turn his hand palm up on a flat surface, and talking about that flexor retinaculum, with his right hand, squeeze the ends of the retinaculum together as if to take the radius and ulna and roll them together. So that's essentially what I'm trying to do, or what he's trying to do with his right hand, is to squeeze that flexor retinaculum in this direction. Can you see that on the tape real well? I'm trying to squeeze the flexor retinaculum to roll the radius and the ulna together. Now, does your wrist feel any different?
Yeah, I do.
Good. So we actually walked those bones back into place again, and we facilitated the flexor retinaculum in order to get that stability necessary to keep those bones in place. Now, when he gets good at the alternating contraction and relaxation, go ahead and contract and relax and contract and relax. At a certain point, he can start moving his wrist around and contracting and relaxing. That helps move those bones back into place a little bit better, but you're always going back and forth with the hands to get those bones to come back into place again. This is a very valuable technique if a person has pain in their fingers, or if they have carpal tunnel syndrome, or if they have generalized weakness for some reason. Getting those bones afferentated, getting the muscles sending the right signals, and getting more balance in that very complicated joint helps to reduce pain. And I think this would be a benefit for your patients. Give it a try, see how it works. Thanks.